Welcome to everybody for this next session. I'm Jenny Hall. I'm going to be just chairing this session for now. I'm going to be taking questions from you at the end. So if you do have any questions as we go through, please add them to the chat box, which is at the bottom of the screen or maybe to the right of the screen, depending on how you've got yourself set up. But please add some questions there and we'll have some time at the end to answer them. But I'd like to introduce you to Gillian Morrow, who will be leading the session just now. She's a midwife at Belfast Health and Social Care Trust. She registered as a nurse in Belfast in 1986 and as a midwife in Manchester in 1993. She was involved in the development of the original midwifery-led care service team within the BHSCT, promoting midwives as the lead professional for healthy women with straightforward pregnancies, offering a holistic model of care and working autonomously within a small team of midwives. Following this, she has held a variety of midwifery posts, including practice development midwife in the Northern Health and Social Care Trust and intrapartum midwifery practice educator at BHSCT. She's currently BHSCT project lead midwife for the Active Birth Centre, which is the alongside midwifery-led unit. Gillian has attained high developed specialist knowledge in interpartum care underpinned by theory and experience. She's a transformational leader embracing and influencing change through service development initiatives and quality improvement projects. Throughout her career, Gillian has continued to develop academically, completing a postgraduate certificate in professional education and a master's degree in midwifery. Her work has been recognised by many awards and accolades, both local and national. Gillian is driven and passionate about midwifery-led services, empowering women and putting mothers first. And she's going to talk to us about the Active Birth Centre. So over to you, Gillian.
Thank you, Jenny. Yes, as Jenny has kindly said, my name is Gillian Morrow and I am the project lead midwife for the Active Birth Centre in Royal Jubilee Maternity Service, which is part of the Belfast Health and Social Care Trust. I'm really delighted to be here today and to have been invited to present to the All Ireland Festival, particularly in relation to the Active Birth Centre. When I submitted this presentation, it was under the category of parents' voices. So I'm going to give you all an overview of the Active Birth Centre and alongside midwife-led unit, how we embedded it in practice, and in particular the emphasis of the invaluable service user engagement we've had, while sharing with you also some of the really positive outcomes and the successes of the Active Birth Centre. Next. Next, Paul. Apologies, everybody. I'm having to ask Paul to move my slideshow through as I can't have control of it.
Sorry, bear with me, Gillian.
That's okay. Always technical problems. And very different presenting virtually to you all, not being able to see you. That's it. Thanks, Paul. Okay, so we all know that robust clinical evidence supports the establishment of both freestanding and alongside midwife-led units. And the alongside are those which are co-located or adjacent to the main obstetric-led delivery suites. The midwifery-led units have a shared philosophy and understanding of normal birth. And we've been supported by the findings of the Birthplace cohort study in particular, which has really showed that midwife-led units are providing the safest and the most cost-effective care for low-risk women. We've also been supported by the RCM evidence-based guidelines, the NICE guidelines, and in Northern Ireland, we're very fortunate to have the support of our maternity strategy. Next. Within Northern Ireland, we're also fortunate to have the regional maternity handheld records, which provide women with information to make informed choices about their birthplace options. We have been involved in the development of regional RQIA guidance for admission criteria to midwife-led units, and also Northern Ireland normal labour and birth pathway, which is embedded within the regional records. And within Belfast Trust, we now provide and are delighted to provide all 4 of the recommended birthplace choices: home birth, freestanding midwife-led unit on our Mater hospital site, and alongside midwife-led unit in the form of the Active Birth Centre, as well as, of course, our main obstetric-led delivery suite. We're really excited currently about the development of our new maternity building, which we hope to be moving into in early 2022. And this will provide a 10-bedded alongside midwife-led unit or Active Birth Centre. We're also really excited about the both local, regional and national move towards continuity of care models, which will have such an influence on midwifery-led care services. Next. So our Active Birth Centre, which is currently a 4-bedded alongside midwife-led unit, first opened in June 2015. However, unfortunately, activity levels in births were consistently lower than anticipated, and not all women who were eligible to birth in the Active Birth Centre were offered this opportunity, or in fact even aware of the opportunity to labour and birth there. There'd been no branding, no marketing and no promotion. And there was unfortunately an absence of standard operating procedures, criteria and pathways. The unit had no core allocated midwifery team, and the midwives within the obstetric-led delivery suite were allocated on a more or less ad hoc basis when a woman arrived in labour. Therefore, there was no team cohesiveness, ownership or unfortunately pride at that point in the unit. Midwifery staff actually told us that they were reluctant to rotate or move into the unit, albeit only round the corner. They reported a lack of confidence, a lack of support, and feelings of isolation. The environment at the time felt and looked clinical and did not offer the calm, comfortable surroundings women wished for. So at that point, the senior multidisciplinary team completed an options appraisal process and agreed to appoint a project lead midwife to project manage the unit, applying a quality improvement approach. So the project commenced in October 2018 with myself as the project lead midwife. And this project continues today, and the success of the Active Birth Centre I'm going to share with you. But what it also requires is a smooth transition into the new build in 2022, which, as I said, will have a 10-bedded alongside midwife-led unit. Next. So the vision of the project was to provide a woman-centred service, not systems-led, and create a positive birth environment supporting the natural childbirth philosophy whilst raising the profile of midwife-led care. And doing this by connecting our communities with the Active Birth Centre, which we fondly refer to as the ABC. This was our quality improvement project, ABC driver diagram, and the vision was being realised through the achievement of the aim and objectives. And as you can see, the aim was to embed and sustain the ABC as a true and viable birthplace choice for women. And we ideally wanted to increase our activity in the first year from 2018 into 2019 by 50% births. The driver diagram highlights the objectives. The primary and secondary drivers very clearly indicated to us that we needed to involve service users throughout all aspects of the QI project in order to achieve all of the change ideas listed. We acknowledged from the very beginning the importance of a fluid engagement process and shared ownership, led jointly by service users, families and staff to ensure success in embedding and sustaining the ABC. Next. So the model within our service, like many others in healthcare, has evolved over the last number of years from an historical information giving model, transitioning to a more consultative partnership and shared decision-making model, to a new and exciting model of co-productive relationships, accepting that service users are not passive recipients of care and recognising their contribution has an extremely positive impact on the successful delivery of our service. Next. So how has the ABC project demonstrated and evidenced service user engagement? These are a number of the events and activities we've participated in as a team. And I'm going to share with you some of the personal and public involvement activities that we've undertaken through the ABC project. Next. And next. So the project is supported by the Maternity Service Liaison Committee, known in a number of UK countries as Maternity Voices Partnership. This is a group of service users, clinicians, charity and voluntary service representatives who work in partnership to improve services in response to the needs of women. The ABC Project Steering Group, next, and operational groups, each has service user representation, next, and they meet regularly to ensure the project vision is realised. We commenced with brainstorming activities with service users and staff. And at the start of the ABC project, we engaged with service users, next, via various forums and social media platforms, including the Northern Ireland Maternity Forum Facebook page. We asked women and their families, what do you see as the best way forward for the Active Birth Centre? What do you see as is possible? What is it that you want from the Active Birth Centre? We also invited staff across the service to leave suggestions in suggestion boxes. So these activities at the very start of the project proved to be really effective, generating a lot of ideas in a really short period of time, and an excellent start point for our QI project. We carried out numerous small PDSA cycles to test these ideas, which directed us to where we should initially focus our efforts. Changes to the environment, need for promotional material, awareness sessions with staff to increase their knowledge and awareness of the criteria to midwife-led units. Next. This was the start of the discovery and design phase. We facilitated a number of joint focus groups, workshops and artwork with women, birth companions and staff together. These were quick and easy to organise and an extremely useful means of engagement with small groups, allowing us to hear individual perspectives and voices. This brought us a rich source of feedback and generated further ideas. Next. And next. And next. So the women using our service had previously named the ABC and the 4 rooms therein: Sanctuary, Serenity, Harmony and Haven, suggesting a calm and supportive spa-like environment which supports a positive labour and birth experience. This was unfortunately how our ABC birthing rooms looked. Next. Cold and clinical, and not what the women wished for. Next. So what we created with the addition of dim mood lighting, Bluetooth music functionality, birthing aids and supports and furnishings, including mats and birthing balls and comfortable upright birth supports and candlelit water birth, providing a much more home-from-home environment, supporting women to mobilise, adopt comfortable, upright, optimal positions, and affirming the philosophy of normal birth. We've continued to improve the environment by the purchase of more birthing aids and upright supporting systems and double sofa beds to invite partners to stay outside of COVID times. Next. This just gives you a little bit of a more of a feel for what the Active Birth Centre actually looks like on a daily basis and how the women wanted it to look. And we're delighted with what we've achieved. Next. Having successfully secured some co-production PPI funding, we were able to work with an in-house artist to further improve the environment. The brief was to create bespoke artwork for each of the 4 birthing rooms within the Active Birth Centre. The artist facilitated, along with ourselves, 2 workshops, one in the antenatal ward for antenatal inpatients and staff, and one evening workshop for service users and staff. These were great fun and also very creative. We created the 4 pieces of felt artwork you can see at the bottom of the slide, framed and displayed in each of our birthing rooms. We agreed on natural remedy healing, herbs, plants and flowers, and the end result was soothing chamomile, relaxing lavender, healing eucalyptus, and calming aloe vera. Next. We wanted to involve women and their families in the design and delivery of their care, and co-production allowed us to work with women and not to them, not only finding out what they wanted, but involving them in every step in achieving what they wanted, recognizing that the voice of these women and their lived experience is integral to the design and development of the ABC. Next. Service users had a voice at the regional strategic level in the co-production of guidelines for admission to midwife-led units in Northern Ireland and the normal labour and birth pathway. And we followed this lead in the co-production of all our ABC guidance, operational guidelines, antenatal pathways of care, transfer criteria, which gave all of our staff an idea of what their roles were. This was a pivotal cultural change, which has ensured very robust guidance for clinicians, but with a clear focus on the experience of our service users. Next. All our ABC promotional material was co-created, and in fact, service users actually led on this, designing the ABC logo, as you can see, information leaflets, posters, and pop-up banners. And the poster here displays Veronica, who agreed to be our poster mother with her baby Lucy, who birthed in the ABC. Next. And next. So the Trust Community Development PPI team provided us with the opportunity to use appreciative inquiry methodology and processes within the ABC project. In appreciative inquiry, we are all equals, leading together, aiming to build the existing strengths of the Active Birth Centre, thus accentuating the successes of the past, evoking images of what was possible, creating the spirit of ongoing inquiry, and creating the dream Active Birth Centre. Next. We facilitated appreciative inquiry workshops with staff and service users to consider themes, foundational questions, and dream questions. And those questions we would ask of our service users and staff, always considering the 4 Ds of appreciative inquiry: discovery, dream, design, and destiny. Once agreed, we developed questionnaires and surveys and facilitated both focus groups and one-to-one interviews with staff, groups, women, their families, and other service users. And we received really rich qualitative data. Next. And the final report has been shared widely with staff and service users across the wider trust. Next. So we agreed it was vital to receive live feedback ongoing from those women birthing in the Active Birth Centre and actually using the service. And we invited them to give feedback via an ongoing survey questionnaire, accessible via QR code and completely confidential. Next. And next, please. We wanted to know if the ABC was being promoted. Did women know about it prior to admission to labour? Were women being given the choices and the options to birth in a midwife-led unit? We wanted to discover how women actually felt about the Active Birth Centre environment and their birth experience, and if they, really importantly, would choose to birth there again, and would they recommend it to family and friends. Next. Women have offered their testimonials and positive feedback and are eager to share their stories via the questionnaires, word comment cards, and compliment emails and thank you cards. And we've been overwhelmed by the positivity and gratitude expressed. Next. I'm going to skip over that, Paul. Thanks. Next. The aim and the objectives of the ABC project have been accomplished and the vision realised, and we continue to be successful. We've embedded a sustainable midwife-led intrapartum service transferable into the new maternity build. We've developed pathways and standard operating procedures. We provide reassurance and shared learning through real-time data collection, analysis and reporting to staff and our service users at various meetings, forums, and via social media platforms. We use run charts and infographic display of outcomes. And I'm going to share with you some of the really positive data that we've gathered over the last 2 years since the onset of the actual project. Next, please. Since the commencement of the ABCQI project in October 2018, we have seen a 199% increase in births in 2020. Which is a further increase from 2019, thus normalising birth, decreasing medical intervention and improving birth outcomes for 565 mothers and babies in 2020. You can see from the slide here in the run chart, the dark turquoise green is 2020 figures and we are on an upward trajectory. Unfortunately, we did have a little bit of a blip during COVID between February and May of 2020, when our freestanding midwife unit was closed temporarily because the Mater Hospital has become a COVID unit, and also in relation to our surge plan for COVID, we decided to move the women from the Active Birth Centre into our main delivery suite, utilising the Active Birth Centre as a cohorted area for COVID positive women. We then realised in June that the numbers of COVID positive women were low, and we were able to return the Active Birth Centre to a midwife-led unit. So between February and June, we were unable to collect any accurate data on midwife-led births, but we're still delighted with 565 births, and this continues to increase. Next. This slide indicates the QI activities and service user engagement that I presented to you, and how that has influenced the activity and births in the ABC, with an ongoing rise from 2017 to current 2020, regardless of the COVID situation. Next. This slide shows you the increase in overall midwife-led births, so home birth alongside midwife-led unit in the Active Birth Centre and our freestanding midwife unit. From 2018, prior to the project commencing, when we had only an 8% midwife-led birth figure across the whole of our service, and we have 5,000 to 5,500 births per year. We're a central tertiary referral unit with a number of women with complex needs, but our midwife-led figures have increased to approximately 18% monthly, and we're delighted with this figure and continue to provide midwife-led care for low-risk mothers. Next slide, please. Transfer rates to obstetric-led care compare favourably to national rates and have reduced between 2019 and 2020, despite the increase in birth rates. So again, this is a very positive impact. We carry out individual case review, which indicates appropriate and safe transfer processes. And we are reassured by the Birthplace cohort study, which suggests that women having a first baby, there is a higher probability of transferring to an obstetric-led unit during labour or immediately after birth. And they recognise a 40% transfer for primiparous women from an alongside midwife-led unit. And in 2020, our primip transfer rate was 45%. And for Paris women, we've reduced from 17% to 12%, and the Birthplace cohort study would suggest a 13% transfer rate. So very positive data and very reassuring to us. Next. This just gives you an oversight of some of the reasons for transfer. Initially, starting from the left-hand side of the graph, the most common reasons for slow progress in first stage of labour, thick particulate meconium, or delay in second stage of labour. The red bars indicate postnatal women transferred, and the main reasons and indications would be postpartum hemorrhage. And these women are transferred after being stabilised in the ABC for either pharmaceutical or surgical management in delivery suite. Our OSI rate is sitting at around 1%, and we do encourage manual protection perineum, but we also encourage water birth for our women. Next slide, please. Our water birth rate has increased from 6% in 2019 to 16% in 2020. We only have one birthing pool currently, and when we move into the new build, we will have 10 birthing pools. Next slide. This slide just demonstrates the importance of an early discharge home for our mothers between 6 and 12 hours. And we've increased between 2019 and 2020, 55% of mothers, up to 78% of our mothers now are discharged home with their babies directly from the Active Birth Centre. So they have true labour, delivery, recovery and postnatal care within the unit. Next slide, please. This is a summary of the service user feedback that I mentioned earlier. Our service users have awarded the Active Birth Centre 4- and 5-star rating in relation to the environment and their individual birth experience. They've also indicated a strong desire to use the Active Birth Centre again and promote to family and friends. That's really important feedback for us. Next slide, please. This is staff survey summary from from the improvement from 2018 when the project started to more recently in 2019, where we have an increase in confidence, knowledge and skill. And next slide, please. Moving forward, we wish to maintain our birth rate between 500 and 600 births per annum, and probably more, closer to 800 to 1,000 when we move into the new build. We want to continue to reduce our transfer rate and build the confidence and skill of our midwives, and continue to increase our continuity of postnatal care with early discharges home for 80% of our mothers and babies. We welcome a review and update of the regional guidance and wish to continue promoting midwifery-led care within our communities. We're excited about our move into the new maternity building and hope for a smooth transition of the Active Birth Centre, and we welcome the national move towards continuity of care model. Next slide, please. No matter what the service development change or initiative or quality improvement project, we need to celebrate achievements, share and spread our success. The activity, outcomes and feedback of the Active Birth Centre speak for themselves, but we are delighted to have been recognised and acknowledged in a number of awards and been invited to present at a number of workshops and events. And last slide, please. So I'd just like to finally thank you all for listening and acknowledge those people that have been involved and continue to be involved in the project. Too many to name, but most importantly, our service users, our mothers, babies, families, our clinicians, the community development and PPI team, Arts Care and Future Smart Coaching for supporting the Active Birth Centre. And thank you again for listening. Thank you.
That's brilliant. Gillian, sorry, I'm trying to get my video back on. It's wonderful, wonderful news to hear what's going on there and what you have managed to achieve in such a short space of time. Liz, if there's anybody who wants to add a question at the bottom into the chat room, then please do so. We've got a time for a couple of questions, I think.
Thank you.
One thought I had is, what message would you give out to anybody else who's planning to do this? What would you like to say to them?
I would definitely say involve your service users, involve your mothers. They have such a strong and powerful voice. And unfortunately, I had embedded in the presentation one of our service users, but I knew I wasn't going to have time to play her video. But Leslie is the chair of our Maternity Services Liaison Committee and also a very active and proactive service user. And she's been integral to the project, as have many, many others. So I would say as a starting point, engage with your service users.
Fabulous. And we've got a question here from Roshan Lennon. How many whole-time equivalent, I think that's WTE, isn't it, do you have working, and how many off-duty at a time?
Roshan, thanks for the question. Unfortunately, we are still currently working without an allocated, dedicated team to the Active Birth Centre, and that is kind of the next steps in relation to the project. So our midwives and delivery suite currently still rotate into the Active Birth Centre on an ad hoc basis. And we were fortunate, one downside of the COVID pandemic is that the midwives who were working within our freestanding midwife-led unit have had to be redeployed as it's currently closed. So they have been redeployed into the Active Birth Centre, which has been fabulous. But moving into the new build, we're currently working on our workforce plan and looking at how that team looks and the skill mix between registrant midwives and support workers. So I can't give you a definite answer at the minute, but certainly moving forward, and I'd be very happy to link back with you again, Roisin, and give you an idea.
That's great. And Rosh has just commented, you have done great to get the results you have. So well done. And yes, I think certainly through the pandemic, there's obviously been lots of change that's needed to be taking place, hasn't it? I mean, that's a brief question I have as well, is how COVID has had an impact of fact women wanting to give birth actually away from the main unit. I mean, has that, do you think, impacted on your numbers?
I think for a very short period of time when we did reallocate the Active Birth Centre to a COVID unit, and that was at the start of the pandemic and the first surge, where we actually felt that we would probably have more COVID positive women, but actually in reality we didn't. So we flipped our surge plan again and realized very quickly that actually it was those low-risk mothers on a midwife-led pathway that actually were going to benefit from utilizing the active birth centre. So with the support of our senior management team, midwifery team, and our multidisciplinary team, we flipped it back to the active birth centre quite early on. But there were probably 3 months where our data, we still had women coming through as midwife-led and supported to birth in the delivery suite with midwife-led philosophy, but we weren't accurately calculating the data.
No, well, it's going to take some time for all that to come out, isn't it, to find out what the impact was in those first few months where we didn't really know what was actually happening.
Absolutely.
Did we? There's a comment here from actually the Active Birth Centre, so it must be one of your colleagues. But how do you address women who are out of guideline but choose ABC as their place of birth? This could be the last question, I'm afraid.
Yes, sure. Yeah, and we have met that scenario on a number of occasions, and certainly within our operational guidance, we have written into that. And we meet with women to birth plan and plan the way ahead, and we approach that from a multidisciplinary background. So usually obstetric team as well as midwifery team will meet with women, see what their requirements are, what their requests are, and support them in their choices. I mean, that is the most important thing. But we work as a multidisciplinary team. So many women want to have what they see as midwife-led care to ensure reduction in intervention, reduced medical intervention, and improved outcomes, as we know, alongside and freestanding midwife-led units offer. And so therefore it's about recognizing what is a reality for those women and birth planning with them and ensuring that their choices are met, but their birth plan safely supports them through their birth experience. And of course, then we have a multidisciplinary meeting on a weekly basis. So any of these women who are outside criteria, then we discuss at that. So the entire team are fully aware and fully informed. But ultimately, we want to support women in their choices.
That's wonderful. Wonderful to hear what you're doing. And would you be welcoming people to contact you to find out more?
Absolutely. Of course, I'd welcome it. I think it's all about sharing, and we're so keen to do that. And I mean, for us, we're learning from everybody as well, so definitely collaborative working is really important in networking.
Well, that's brilliant to hear. And you've heard it. You can go and contact them and perhaps go and visit if you need to and set these up for yourselves. So thank you so much, Gillian. Really appreciate what you have done. And we do need to move on now to the next part of the seminar that we have in this session. So